Good morning, everybody. I'm going to talk about cannabis and its effect on driving, and comparing that with other drugs and alcohol. So I'm Ezra Helps. I'm a cannabis consultant, and I really wanted to focus on this issue about cannabis and its effect on driving. Because it's the holiday season and there's a lot of driving happening and there's a lot of people in our cars. And as medical marijuana laws become relaxed across the country, people want to know what is happening with our drivers who are impaired with cannabis, and how can we be safe, and how does it all compare to other drugs and other things that are legal. Which is something I do. Often we don't have a standard for cannabis, so usually I just look at, all right, what are alcohol's effects on driving? How do alcohol and cannabis compare? And I'll also look at other drugs, specifically benzodiazepines. These are drugs like Valium, clonazepam, Ativan, things like that. So I'll do some comparisons there. Welcome to my livecast. My focus on cannabis is that it's a medication. So we have to be aware that even people who are not trying to get high and not trying to drive under the influence of cannabis may be in situations where they're using cannabis, or they used it the night before, and we want to know, are they safe? So feel free to ask a question as you come on board the live cast, and I'll take a break and answer it as we go along. This is the question. So a lot of people think cannabis is not so bad, that it doesn't impair driving, but I want to just say right off the bat that it does impair driving. Cannabis does actually reduce your ability to make decisions as a driver. So it's not entirely safe. But here's where it gets interesting already, and that is we know that alcohol is very dangerous for driving. And in fact, in studies, they've done big studies on this, they've found that the legal limit of alcohol is about equal to cannabis's effect on driving. So when you have small or large amounts of THC in your system, it's about the same as what we legally allow people to drive under the influence of alcohol. It's also about the same as driving at night or driving with extra people in your vehicle. So when you drive at night, it's a little bit more dangerous than when you drive during the day. When you drive alone, you're a little bit safer than when you're driving with people in your car and who could distract you. And so cannabis fits in that category, meaning you can be impaired. So if you're driving at night and you have people in your car, there is a higher risk of a traffic accident. If you add cannabis to that, you're also going to increase that risk. But the studies on cannabis can be misleading. They seem to show different things. One, they find that people who are experienced cannabis users tend to compensate for driving. They tend to be able to control their driving a little bit better than new users. So somebody is newly using cannabis, they will be much more impaired than people who have it in their system and are very comfortable with what it feels like in their system. So those people have decreased dangers. So it doesn't mean that because you get stoned all the time or use cannabis medicinally all the time that you're okay, that you're safe. You should be aware that it can still be an impairment to driving. Now, there's also one of the things that confuses the studies is how long THC is in your system. So you could smoke a joint on Friday night and then Saturday afternoon get pulled over by the police, and they could take a blood test and find THC in your system, but you may not have any impairment from that THC. A lot of people, I've read studies where they call this, one of the reasons why we should be wary of cannabis, that it's more dangerous because it stays in your system for a long time. But it's important to remember that cannabis is not toxic to the system. So the system doesn't really find a need to get it out of your system quickly. With things like alcohol and cocaine and some other drugs, your body does find them toxic, so it gets them out of the system really quickly. So the fact that THC stays in your system makes some of the studies a little more confusing. So one of the interesting quotes I took from a study, and this is from the American Journal of Public Health, a study in 2017 on traffic fatalities, and they found that experienced smokers who drive on a set course show almost no functional impairment under the influence of marijuana, except when it is combined with alcohol. So the emphasis here is on experienced users. So if people are very comfortable with cannabis in their system, there does not seem to be any statistically relevant impairment in their driving. Except when you combine it with alcohol. So combining it with alcohol, because alcohol does impair, cannabis does increase the effects of things in our system. It can increase the effect of opioids and therefore bring down our use of opioids. That's a good thing. But it can increase the effect of alcohol and make us impaired. So when you mix alcohol and cannabis, you are significantly increasing the dangers on the road. Here's an interesting thing, though, too, going in a little deeper to the nuances and of these studies. And what they find is that marijuana users, when they get high, they tend to overestimate their impairment. What this means is if they're stoned and they are about to take part in a driving test or drive, they think that they're actually worse off than they are. They think that they're more impaired and are more in danger. And therefore, they slow down. In fact, it's a great quote from a study. It said, cannabis use was associated with a decrease in driving speed despite explicit instructions to maintain a particular speed. So users were told to maintain, say, 25 miles an hour, but actually unconsciously decreased that speed because they felt more stoned. So this is not an argument for getting stoned and getting behind the wheel and driving, but it does show us that there's a very different response in our consciousness and in our body when we consume cannabis than when we're using alcohol. Alcohol findings were almost the exact opposite. People tended to think that they were less impaired when they were impaired, and their speed increased under alcohol consumption. So when you compare those two, those have much different outcomes. The fact that you might be decreasing your speed and you think you're more stoned than you are, or more impaired in terms of driving than you are, the chances of having a traffic accident are going to go down, versus alcohol that makes you think you're safer than you really are. That's a very dangerous combination. So the reason why I want to focus on cannabis at this time is we do have a lot of young people who are consuming cannabis. We have a lot of young people who are visiting their families and driving to see their families. It's a really it's a time for a lot more increased traffic accidents. But here is a fascinating result of the legalization of cannabis across the country. So now that we have over 30 states that have legalized, we've found that people, that they have a lot of data on cannabis. And the highest risk age group for traffic fatalities and alcohol fatalities are the 15 to 25-year-olds. They're the young men, essentially. High school and college-age men tend to be very impaired during driving and tend to have more traffic accidents. But this is a fascinating study here that showed medical marijuana laws were associated with immediate reduction in traffic fatalities in those aged 15 to 24 years old. So this is, again, from the American Journal of Public Health in 2017. And so what this indicates is that once you relax laws, when you decriminalize, when you legalize medical marijuana or legalize adult use of marijuana, there is an immediate decline. And it's difficult to know exactly what's causing this, but people are projecting that it's probably the decrease in alcohol use. So when you actually have people who are more able to access cannabis legally, then that's all the drug they need for that evening, and they tend to be slower on the roads, and their impairment is affected, but far less so than alcohol. So although I consume alcohol, much of my family members and much of the entire country consumes alcohol, especially around the holidays, we just have to remember that this is a drug that's slowly becoming legal, that is much safer than alcohol in terms of consumption and driving. So I want to first talk about, as I always do, the difference between the caffeinated version of cannabis and the decaf version. So caffeinated or strong cannabis that impairs you, is cannabis with THC in it. THC, tetrahydrocannabinol, is the psychoactive ingredient in cannabis. So all these studies are around using cannabis that gets you high, gets you stoned. And it's important to remember that there's this secondary, safer molecule in cannabis called CBD, cannabidiol. And CBD is a analgesic. It's been shown to reduce pain, reduce anxiety, and it's a regulator in our system. So you can consume marijuana or cannabis or hemp-derived CBD. CBD, coming from any of those sources, is basically the same CBD. There are different effects for different strains of plants. But basically, CBD is really important because this is a way that you can consume cannabis, get some of the medicinal benefits from it, but not be impaired cognitively. We don't have as many receptors for CBD in our brain, so we can be clear-headed and drive using CBD. And the reason why I think CBD is important is for what I'm going to go into next, and that is comparing cannabis to the legal drugs that we have available. Alcohol is available and legal, and medications are available and legal. So what do meds do? What do meds that we take for anxiety and pain do in our system when we're driving? This is important to think about as well. In fact, I forgot to mention at the beginning that December is Drugged and Driving Prevention Month. So I'm really focusing on this issue because I believe strongly that we should be informed about cannabis and what it does in our system, but also be aware that compared to other legal things, it is much safer. So because marijuana does enhance the effects of some drugs, like alcohol. So if you mix alcohol and marijuana, your driving will be impaired. If you mix opioids and cannabis, your pain will go down greater. You won't need as much opioids. But the opioids is an interesting study because the data on opioids, so pain relievers, and driving is pretty sparse, actually. So far, what they're finding is that it's not a major impairment. Sounds like, from what I read, the studies on opioids show that it's about similar to cannabis and about similar to driving at night or driving with multiple people in your car. So it is a slight risk, but not a significantly statistically advanced risk the way alcohol is. But it's important to remember that alcohol users, when they're driving, underestimate their impairment. They tend to drive faster. So alcohol and marijuana do not mix. Now, benzodiazepines is something that I'm fascinated by as well. I get a lot of clients who come to me with benzodiazepine withdrawal syndrome. So this is when you take drugs like Valium, Ativan, clonazepam. There's a whole class of drugs called benzodiazepines, and they can be very addictive. They're not necessarily euphoria causing, they don't feel good in the system necessarily, but it's very easy for the brain and body to become chemically dependent on these drugs. And they're often used, Valium is used for helping people sleep. It's used to reduce anxiety. So these are very common drugs that cannabis is similar to. You know, cannabis is an analgesic, it reduces pain. Cannabis also helps with sleep if done properly, and can reduce anxiety also if done properly. And here's the findings on benzodiazepines. So the experimental studies indicate that Valium can impair a wide range of task processes in driving, and the impairment appears to be significant even after 3 weeks of continuous impairment. So what this implies is that benzodiazepines can, even after a user has been on it for a few weeks, is still impairing them, even at smaller doses. This is the opposite from THC. What they're finding is people who become accustomed to THC, or are used to it in their system, their driving impairment is safer. The impairment goes down. So that's important to think about with benzodiazepine. And in fact, benzodiazepines as a group are associated with 60 to 80% increase in the risk of traffic accidents. So our takeaway here from the lecture is, yes, cannabis can impair your driving. It's very important to have a designated driver, even if you're a cannabis-only user. But it is nowhere near as dangerous as alcohol as far as how it impairs you and your response to the drug. You actually feel more in danger when you're on cannabis than you actually are. You tend to reduce your speeds. And then if we're comparing it to other drugs that are medicines designed to reduce anxiety, increase sleep, and decrease pain, we can actually seek to utilize cannabis more effectively and have a decreased impairment in our driving. So benzodiazepines, I am not a fan of benzodiazepines. I've had many people who say that it works for them, and I've seen it happen, so it's great that they exist for people who need them and can benefit from them. But many people struggle with benzos. Many people become addicted to benzodiazepines. The withdrawal syndrome from benzos is very severe, and it impairs your driving more so than cannabis. So if you live in a state where medical marijuana is legal or have access to it, it's important that you know the difference and can utilize it. And finally, I would say, if you're at all wary of the effects of THC or cannabis on your system, explore CBD. CBD is a fascinating molecule. It's readily available. You can buy it from me at EzraHelps.com. And I can show you how to use it. I've worked with patients in helping them wean off of benzodiazepines and utilize CBD for their symptoms instead. So thank you all for joining me on my talk about cannabis and driving. You can go to my Ezra Helps group. It's a private group on Facebook. Join the conversation. You can also find me at EzraHelps.com. You can email me at Ezra@EzraHelps.com. Next week, December 26th, I will be talking about how to address cannabis with your family. So everybody's going to be gathered around at Christmas, and how do we have this discussion? How do we, convince the people we know who are on opioids or benzos or use too much alcohol to consider using something that's safer for them? So I'll be talking about that next week. And thank you all so much for joining. Feel free to share this video. And until next time, I'm Ezra Parzybach, Cannabis Consultant.